Okay, thank you so much for joining us for this exciting evening to discuss BC Kids and COVID-19 with Dr. Katharine Smart, the 2021-22 President of the Canadian Medical Association. I'd like to begin by acknowledging that I, as well as my COPAC colleague, Simon Adams, are joining you from the traditional and unceded territory of the Okanagan peoples. Several of my other colleagues here tonight are joining from different territory. First, we have Gord Lau, the chair of the Vancouver District Parent Advisory Council. Gord?
Thank you. I would like to acknowledge I'm joining this live broadcast from the traditional unceded territories of the Musqueam, Squamish, and Tsleil-Waututh peoples.
And Rena Diaz, President of the Surrey District Parent Advisory Council. Rena?
Welcome, everybody. Today I'm speaking to you from the shared unceded traditional territory of the Katsi, Sabiamu, Kwantlen, and other Coast Salish people. Thank you so much for taking the time away from your families to join us.
And of course, our special guest this evening, Dr. Katharine Smart. Dr. Smart is a pediatrician in Whitehorse, Yukon. Her work is centered on developing collaborative partnerships with community and government services to serve marginalized children using a model of social pediatrics. She works primarily with children who experience trauma and adverse childhood events, and she witnesses the broad and lasting impact these events have on children and their development daily. She's passionate about improving services for marginalized children in an effort to change their life trajectory. In addition to her community-based work, Dr. Smart enjoys acute care and provides on-call services to the hospital. Before moving to the Yukon, she was a pediatric emergency medicine physician at the Alberta Children's Hospital in Calgary. Dr. Smart is the past president of the Yukon Medical Association. We're thrilled to have Dr. Smart join us this evening because through this pandemic, as leaders of parent advisory councils and district parent advisory councils in our communities, we've heard from many concerned parents and received many questions on the topic of COVID-19, specifically related to our schools and the safety of our children who attend them. We're so pleased to be able to host someone who can answer some of the many questions we have received and bring a national perspective to the conversation here in BC. Dr. Katharine Smart, welcome and thank you so much for joining us.
Thank you so much. I really appreciate the opportunity to meet with you tonight, and thank you to all the parents who have taken time to join this conversation. I just want to start by saying, I so appreciate how challenging these 20 months have been for parents and families in particular. I think, so many of us, myself included, I'm also a mom of 2 children, have been balancing, the demands of our work and our families with our ongoing concerns about the pandemic and the impact on our communities and our families, and especially our children. And I think this fall has been particularly difficult as case numbers have been increasing in kids, and a lot of parents are feeling really uncertain about safety and how to move forward. So tonight, I'm hoping to speak to you about what we know so far about COVID-19, where we're at right now in the pandemic, and then, of course, talking about vaccination, given that the vaccine was just approved in 5 to 11. So I'm going to give a presentation where hopefully I answer some of your questions, and then I understand that there's several questions that have been submitted that we'll address as well. So tonight, I hope to share that perspective as a pediatrician. I've been in pediatrics for 20 years looking after kids. So I have lots of experience in that space, and I'm excited to share that with you. The national lens that I've gained through my work with the Canadian Medical Association, and then always the lens of also being a parent and how I think about this and make decisions for my own kids. So next slide, please. All right. So the impact on children, I think what's been challenging with COVID is the impacts of it for kids have been very broad and really very variable, and not all children have been impacted in the same way. The biggest impacts we've seen in Canada for children have really been the social side of COVID. The lockdowns, the school closures, the loss of activity, the loss of connection with friends and family, that's had really significant impacts on our kids. And we're seeing that reflected in increasing concerns around mental health. And there's been a huge increase specifically in eating disorders, especially in teenagers, but just in general, a real spike in mental health that I think was already happening before the pandemic, but has been made worse by the pandemic. Some children have experienced the loss of a caregiver, and globally, this is over 1 million children. So that's really, really concerning. And this has disproportionately happened in racialized communities, and that's true in Canada as well. Then there's the impact of COVID directly on children and their health. And the concerns we have there, of course, are around them needing to be hospitalized, needing intensive care or critical care, of course, death being the worst possible outcome, although rare. But then the other impacts of COVID, such as the multi-inflammatory systems condition, which happens to be highest in kids aged 5 to 10, and then long COVID, which is something we're still understanding. So as an infectious disease, the impacts are certainly a lot more than just the disease itself. So next slide, please. I think for a lot of parents, I'll just get you to go back to the slide before that, please. I think for a lot of parents, naturally, one of the biggest things on people's minds is how dangerous is this for my child in terms of their health, the direct impact of COVID that way. And how does it compare to other infectious diseases we've dealt with before, we're perhaps more familiar with? So what we know so far is that hospitalization rates for COVID-19 in children appear to be quite similar to the flu. However, what's been interesting is the data in Canada is actually coming out fairly different than what we've seen in the United States. So what I would say is, late in the summer when Delta really started taking over and it was clear that it was much more contagious than the original strain of COVID, and we were seeing, increasing fourth waves here in Canada, but really significant fourth waves in the US, including in children with a lot of hospitalization and very sick kids. It was pretty scary to wonder what our fall was going to be like. What's been interesting is the data in Canada has actually been quite different than the United States in terms of hospitalization. So what we know is initially the data was telling us about 1% of children with COVID ended up in hospital. But that actually has been different in Canada. Our numbers are about a quarter of that. So we're more at about a 0.25%. So our hospitalization rate is quite a lot lower than what they're seeing in the US, which is of course excellent. Why that isn't entirely clear. We think it probably has something to do with our healthcare system, our social determinants of health being somewhat different, and also rates of childhood obesity being not as severe in Canada as they are in the US, as that's shown to be a major risk factor for COVID. What we do know about COVID hospitalizations compared to the flu is they do tend to be longer for kids who end up in hospital. And again, data out of the United States was showing that about 1 in 3 children who ended up with COVID in hospital ended up in the intensive care unit. Our numbers are less than that. We have seen children need to be into the ICU, but the numbers are more like 1 in 4 or 1 in 5 of kids who are admitted. So not quite as common as what we're seeing in the United States. What we do know is that when we look at who gets sicker with COVID, which children are more at risk, 2 out of 3 kids who end up hospitalized do have underlying medical conditions, and those can range from a variety of things. Obesity is probably the biggest risk factor. In the United States, asthma has been a significant risk factor, but what we're learning in Canada is that hasn't been so much of an issue here, but kids that have other forms of chronic lung disease and underlying conditions such as neurological conditions, perhaps some genetic disorders, those children have been more likely to be hospitalized. And 1 out of 3 children with no previously known medical conditions has still gone on to develop severe COVID. So the bottom line is really can happen to any child. It is rare, but it's hard to know for sure who could have that as an outcome. Next slide, please. In addition to that sort of acute picture, I think one of the major concerns around COVID are some of the post-COVID syndromes that we're seeing, and they're actually more common than actually getting really sick from COVID itself. So what we know is that post-COVID conditions that people are also calling long COVID do occur in children. Again, like so much of the information around COVID, it's evolving what we know about it. And there are studies underway in Canada to help us better understand exactly the impact on Canadian children. From the studies that we have sort of from different populations, the rate looks like it's anywhere from 4 to 14% of kids. I think most people think it's going to land somewhere around 3 to 4% of children who get COVID can go on to develop long COVID. So that, of course, is a definite concern. And what's important to understand about that is it doesn't just happen in children who've had the severe case of COVID. It can happen in children who have had mild disease or even asymptomatic COVID. So what does it look like? Like when we're talking about this, what do we mean? So for most people, most children, it's persistent fatigue, headache, trouble sleeping, troubles concentrating. Some people call that a brain fog, and ongoing muscle, joint pain, and cough. And it can last anywhere from weeks to months. Next slide, please. The other, I think, major issue to really consider with COVID is how it's impacted quality of life for children at the school-age children. What we know is the mitigation and precautions that have been put in place to keep our community safe have really limited the physical activity for kids. And that's been associated with an increase in obesity actually in children, and fewer social interactions, which of course for kids has been really challenging. We also know some children, depending where you live in the country, have lost a significant amount of in-person learning due to school closures, and also due to missed school needing to quarantine after either exposure to COVID or having COVID itself. So those social impacts are really substantial. And I think those are things that have impacted all children really to some degree. There's no family, I don't think, that's been spared from this entirely. Next slide, please. Wanted to talk a little bit about the vaccines and what we know and what's different between the pediatric vaccine compared to the adult vaccine. So you've probably heard by now that one of the main differences is the dose. So the pediatric dose for kids 5 to 11 is 10 micrograms of mRNA versus 30 in the adult dose. NACI has recommended an 8-week interval between doses, which is different than the original studies that were done, which had a 21-day interval. And the rationale for that is that because in Canada, early in the pandemic, we actually moved forward with spreading out the interval to allow more people to be vaccinated up front. They've actually shown that the vaccine tends to provide longer lasting immunity when the interval between the doses is somewhat longer. So that's one of the reasons they've suggested that. I think as people are also aware, the major serious side effect we've seen from the vaccine in adolescents has been myocarditis, and I'll speak a bit more about that later. And there's some evidence to suggest that spreading out the dose may decrease the risk of that as well. So that was another part of the rationale, although that's still something that's being more understood. But NACI felt those were two reasons to consider an extended dosing interval. The mRNA itself, so the active part of the vaccine, are the same in both versions, but the buffer used to stabilize them is different. So the buffer in the pediatric vaccine is something called TRIS. It's basically like a base that affects the pH and the storage of the vaccine. It's not really active beyond that. The adult buffer was a phosphate buffered saline. So that's changed. And the big difference why they've changed it is with the TRIS buffer, it allows the vaccine to be more stable, and it can be in a regular fridge up to 10 weeks, which is huge because initially when we were dealing with Pfizer, it needed to be stored at very low temperatures, which really limited where it could be located. And the transport of it was quite complicated. And that of course had serious implications for rural and remote communities like you would have throughout British Columbia, and also we have here in the Yukon, because naturally those places were more difficult to reach. So that's, I think, a definite advantage and improvement. Next slide, please. Vaccine effectiveness, of course, was really important. And the vaccine authorization that's happened and the Health Canada approval was based on the Pfizer study that was based on this concept of immunobridging. So what they did is they compared neutralizing antibody titers after 2 doses in younger children compared with older people 16 to 25. And what they found is those antibody levels were very similar with the 10 microgram dose in kids versus the 30 microgram dose in young adults. And the vaccine efficacy for 2 doses, and now in this study, of course, they were 3 weeks apart, was almost 91%. So excellent immune response in younger kids, an excellent immune response with that lower dose. Next slide, please. Vaccine side effects, of course, are important, and that's something that parents, of course, really worry about. And what's interesting with this vaccine is so far the side effects we're seeing are really very similar to what we see with other vaccines, other routine childhood vaccines. So pain and redness at the injection site, some fatigue, headache, chills can happen, and fever does happen, but it's been less common than in older kids. So with that slightly lower dose, we're seeing less side effects. And of course, there's ongoing monitoring in place right now for rare serious adverse events. And there's an excellent vaccine surveillance program in Canada called Impact, where they monitor post-market vaccine surveillance to detect rare events that would not be detected in a study. Because of course, when studies are done, they're not powered to look for things that are very rare. So if something's, 1 in 100,000 or 1 in a million, you'd have to have millions and millions of people in the study to find those really rare events. But of course, they're important that we have surveillance looking for those. And that's why the work of Impact is so important. I think we're fortunate in Canada in that in the United States, they've already delivered over 3 million doses of the vaccine to kids 5 to 11 over the last few weeks. And so far, there hasn't been any signals of any adverse events that were not anticipated. But of course, this will continue to be monitored. And it's I think, fortunate for us that they're a little bit ahead of us because it gives us access to that information on a large scale. So I think our confidence in that is going to just continue over the coming weeks as we deploy the vaccine to more people. Next slide, please. One of the biggest concerns, I think, for parents has been around myocarditis, because that's certainly been the most significant side effect we've seen in the adolescent age group. And I think that's caused a lot of people concern. Understandably, it's a very fair thing to be worried about. Again, this is something that we're getting more data on and understanding more as time goes on, but you can sort of see the numbers here on this chart and how common it was in that 12 to 17 age group. And what you'll see is it's more common after the second dose, and it's much more common in boys than girls. Again, why that is exactly, we're still trying to understand. Most of the theories they think it's something to do with testosterone, which is also why it's tending to happen in older adolescents and young adult men as opposed to the younger children. It's also why we don't anticipate this to be an issue, even though it's been rare in 12 to 17. We don't even really expect these numbers in younger children, really for two reasons. One is they're prepubertal, so we don't have the testosterone as a factor, but also just myocarditis in general is much more uncommon in kids 5 to 11. So it's not a condition that they tend to be predisposed to. So again, this of course is something that's being monitored post-market with post-market surveillance. But right now, we're not anticipating this to be a large concern. I think it's also really important to note, I think, again, for parents, when you're looking at this information on myocarditis, it's sometimes challenging for people to situate, like, what does this exactly mean? And what we know is the risk of myocarditis from COVID itself is about 16 times higher than the vaccine. So on balance, the vaccine is still very safe. And by far, the vast majority of these cases of myocarditis in teenagers have been mild and self-limited. Some people have required hospitalization, but not the majority. And most people have responded just with basic over-the-counter medication like Advil and had full resolution of their symptoms. So understandably worrisome, but looking like something that is self-resolving and in general not that serious and much safer than encountering COVID yourself in that age group. Next slide, please. Another thing that people are wondering around the vaccine is it safe for kids to get vaccinated if they've already had COVID, and is it necessary? So in the clinical trials that were done, 9% of the kids had previously had COVID. And what they noticed was those children who'd had COVID before being vaccinated had fewer side effects after the vaccine. So less sore arm, less fever. And the post-vaccine antibody levels in that baseline seropositive group was actually higher than kids who had never had COVID. So they had an excellent response to the vaccine and potentially will have almost more long-lasting immunity because it's almost like a booster after having had the infection itself. What we know, what's interesting, and again, another reason for recommending the vaccine, even if the child has had COVID, because that's something people wonder, if you've had natural immunity, is that enough? What we know is that US Delta wave surge of pediatric hospitalizations that we saw this fall happened even though almost 40% of those kids had actually already been exposed to original strain COVID and were seropositive. So what that really suggested was that past infection alone isn't sufficient to provide broad and long-lasting protection against COVID. And the papers that are coming out around adults are similar. They're showing the best immunity for people that have had natural infection is to still go on and be vaccinated, and it appears to create longer-lasting immunity. Next slide, please. So I think when we think about, what are the benefits of vaccinating kids against COVID-19 now that it's become a vaccine preventable disease for kids 5 and up? So I think there's really several things that we can think about. Most importantly is the impact on the child as an individual and their own health. So what we know is if they're vaccinated, there's a much lower chance of them getting COVID, and if they're exposed to COVID, of getting ill. There's a lower risk of those longer term complications, including the multi-inflammatory systems condition and long COVID, lower risk of spreading to friends and family, and less chance of needing to miss school or activities after an exposure. Again, depends on what the public health rules are exactly where you live, but often the self-isolation recommendations are different for people who are vaccinated versus not. I think really important for kids is to be able to safely return to their fun activities, both school and extracurricular, and to be able to do that with peace of mind for both them and their parents. And really for kids to be able to get back to being kids again, because as we talked about before, the biggest impact really in for children with COVID has been those social aspects. Next slide, please. So, I think right now, kind of top of mind for a lot of parents, given that this was just approved last week and it's starting to roll out here very, very soon, is, should I vaccinate my child now or should I wait and see? And you may be on either side of that fence. We know that a lot of parents are planning to vaccinate, and certainly even today, we were hearing from across the country, just thousands and thousands of appointments being booked, which is great. And you may be in the camp of, yeah, I'm comfortable, I want to move ahead. But it's really reasonable to have questions, and you may still be sort of on the fence with a decision. So what would be reasons to vaccinate your child now? As we talked about already, I think it's really the most important thing is lowering that risk of serious illness and death, those post complications, and being able to be back into that more normal school and being able to limit things like having to quarantine and getting back to friends. Next slide. Some people may want to wait, and you may have a variety of reasons why that is. Some people may be worried about the side effects that might temporarily interrupt their plans. Some people may be worried or are feeling unclear about the risk of very rare vaccine side effects, for example, like myocarditis. And again, that data is going to keep rolling in as we get more experience with this vaccine in that age group. And some people may be living in areas with low numbers of COVID-19 and feel like overall their child has a lower chance of being exposed. And that may be a reason that families are feeling like they want to wait and see. But COVID-19 numbers can change very quickly. So that's important to understand. I think what we would say, is right now, we certainly want to encourage parents to ask questions and not feel pressured around accepting the vaccine. And you may decide to wait as a short-term plan, but we'd certainly encourage you to continue to follow public health advice, of course, really for anyone, but particularly if your child's unvaccinated, to lower the risk of COVID-19 while you would decide, and to continue to listen and follow the data as things evolve and reconsider that decision. Next slide, please. So, what do we know right now about COVID-19 infections that might impact your decision? With the Delta variant, COVID-19 has become incredibly contagious. I think the most comparable thing that most of us are familiar with is chickenpox. I think most of us know when we were kids ourselves, everybody got chickenpox. It was just an inevitable part of childhood. And that's now changed with vaccination. And that's, of course, not very common. But because Delta is so contagious in the way it's spreading, we know that most children are likely to be exposed to the virus within a year. So it's going to be hard to avoid forever. And of course, as society is getting more back to normal, there's going to be more opportunities for exposure. And of course, none of us, I don't think, want to continue living these very abnormal pandemic lives any longer than is necessary. So it's kind of coming your way, whether you like it or not, unfortunately. But we also know that most children with COVID-19 will have mild illness. And I think that's important to state. And again, it's not to underestimate the significance of COVID. COVID can be serious, but fortunately for most children is going to be a mild illness. And I think some parents feel conflicted when they hear that, because then they're like, well, if it's mild, then why should I be worried? So that maybe seems odd. And then I think other parents worry that it's being minimized and actually it's more severe, and they're feeling conflicted, like, is it really mild? So I'm going to get into some more detailed data about that later and how it compares to other diseases that we're familiar with historically, so that you can kind of situate COVID within it. But I think it is important for parents to understand there are these risks that we've been talking about, but the goal is not to terrify people about COVID in young children, because the data doesn't support that. But it also doesn't mean that it's not something that we can be cautious about and prevent. What we know is just like I said, some children, even children without any other health conditions, can get very sick and die from COVID-19. That's rare, but it does happen. And COVID can give you these other long-lasting problems, which is concerning. And as I mentioned before, I think it's important to understand that the myocarditis is much more common and severe after COVID-19 infection itself than from the vaccine. So that's not something you can completely get away from. And also the MIS-C is much more common in kids 5 to 11, which is the age group that we can now vaccinate and potentially prevent that complication. And just in terms of numbers, it's about 1 in 3,500 cases of COVID will result in that condition. So that's kind of what you're dealing with in terms of risk there. Okay, next slide, please. So I think we've talked about this already. This is just another little summary. I'm going to just skip to one of the extra points on this slide that we haven't talked about, which is that vaccines do not affect fertility genes like your DNA or hormones. That's been a common concern that people have also had around the vaccine is, especially I think parents of girls have wondered, is this going to have impact on them getting their period? Is it going to have impact on their long-term fertility? And there's really no scientific reason to think that. There's nothing about the vaccine that targets the reproductive organs. The vaccine does not enter your cells, so it actually cannot alter your DNA, and it has no impact on your hormones. So that's one of those sort of pieces of misinformation I think that's spreading, but there's really no basis to that. Next slide, please. I just wanted to share this graphic with you that I think is a really just nice example about how the mRNA vaccine works. And this is from the University of Waterloo Pharmacology Department, which has lots of great resources around COVID, and it's a great website to check out. So again, when the mRNA vaccine is injected, it enters your bloodstream. It does not interact with your DNA. It does not go inside your cells. But what it does is it's messenger RNA because it's sending a message to your cells to start building. And what your cells do is they build the spike protein that matches the spike protein on COVID-19. And it's that spike protein or the crowns that we see in the pictures of COVID that let COVID go inside our cells and cause illness. Once those proteins have been made by your cells, your immune system recognizes them as foreign and starts to make antibodies. And it's during that period of making the antibodies that some people will have some of the vaccine side effects like fatigue, aches, fever. And that's just a sign that your immune system is reacting to the vaccine and starting to make those antibodies. So once that process has happened, your body then can recognize the COVID-19 spike protein and is more prepared to fight the infection if you're exposed to the virus. The mRNA itself dissolves in your body about 2 to 3 days after being vaccinated. So that's important as well, because that's another sort of piece of misinformation that's spread is that people think this mRNA lingers in your body indefinitely, but that's not correct. It's gone within about 2 to 3 days. And that's also, again, how this vaccine works is why we don't anticipate any long-term impacts from the vaccine, because that's another concern that people have is, is there going to be something down the road that we didn't anticipate? But because the way it interacts with the immune system, because the fact that the mRNA is gone in your system within a few days, the vaccine side effects that we see really happen within 6 weeks of vaccination, and there's no scientific reason or other vaccines that have caused long-term impacts. So we're not anticipating that either. Next slide. So I just wanted to kind of give you this historical perspective. These next two slides are from CDC in the United States, where they're sort of putting into context for people how COVID compares to other vaccine preventable illnesses in children. And this slide shows how frequent hospitalization is per 100,000 people for some of these other conditions that we vaccinate with. Now, this again is based on US data, so the numbers would be slightly different in Canada, but it gives you a rough idea. So what you can see is when you compare to other things like Hep A, chickenpox, flu, the hospital burden is similar between COVID and influenza. Influenza fluctuates because different years are more severe. So there's some years that very few children get sick from the flu and end up in hospital, and some years it's more serious. But what you can see is that part's similar. Chickenpox, which we now vaccinate for, caused also a range of hospitalizations, but things like hepatitis A never really did impact kids in terms of being hospitalized. So certainly what you can see is COVID is not an outlier in terms of the amount of illness it causes is really quite similar to other diseases that we now prevent with vaccination. Next slide. The other thing, of course, people wonder about are deaths. And I think, here again, this is based on US data, which is why the average deaths per year is higher than what we've been seeing in Canada, thankfully. But what you can see is COVID does appear to be more significant than in terms of the risk for death for children than several other common illnesses that we vaccinate for, things like, again, Hep A, meningococcemia, which causes meningitis and sepsis, which is bacteria in your blood system, varicella, which is chickenpox, rubella, and rotavirus. So again, I think, to me, what the message here would be is It is really uncommon for children to become really sick from any infectious disease. That is not a common outcome, really, for many things in children. And for children to die from an infectious disease is extremely rare, thankfully. So when we're using death as the metric to sort of decide if we think COVID's serious for children or not, it's really quite a crude metric in pediatrics because death of children is so uncommon. And I think what we can see here is sort of the risk it's posing to kids is very much in line with other infections that we prevent through vaccination. So from our perspective as pediatricians, how we would look at this is if COVID can be a vaccine preventable illness, which it now is, and the risk of the vaccine is very low and the vaccine is safe and effective, on balance of risk, it would make sense to vaccinate because of all the benefits of being vaccinated. And that's really the lens that we're looking at the COVID vaccine through as well. Next slide, please. Wanted to give you a little bit of context just in terms of the BC and what's going on specifically in your context when you're sort of thinking about where you're at with COVID. I know some new slides came out today from Dr. Henry, who presented some updated information, but this information is current to the end of October and the numbers haven't changed a lot. So what you can see there is we've definitely seen hospitalizations in that group under 10 and the 10 to 19, and those numbers have gone up a little bit, but not massively. We've had several ICU admissions in that age group, and there's been 2 deaths in kids under 10 in British Columbia from COVID. Next slide. And then here, when you sort of track age groups and the numbers of cases as we look sort of through the months of the pandemic of 2021, what we can see is sort of what we expected. You know, as things started opening up more after the summer, the numbers of cases started increasing in children as the number of cases in the community increased. And it particularly started increasing in kids who couldn't yet be vaccinated, which isn't surprising because we know if you're not vaccinated, you're more likely to get COVID. We know the more interactions you have with your community, the more likely you are to get COVID. But I think what's important to understand is it's been clear all along, and I think this still holds true, that the rates of COVID in children really reflect what's going on in the community. So the higher the rates of COVID in the community, the higher rates that we're seeing in children. And that reflects the fact that most children are encountering COVID in their social interactions outside of school. Now, that doesn't mean no children are getting COVID at school. Some kids have gotten COVID at school, but the evidence doesn't suggest that it's the main driver of infection. And when you look at some of the data that was presented today, because this is something that's being tracked quite closely in BC, and the slides that came out today, what they've shown there is in British Columbia, there's 1,862 schools. 181 of those, which is about 10%, have had a cluster of cases within the school. And by a cluster, that means 2 to 18 children in the same school have been infected, but the median number is about 3. And right now there's 55 schools that have having a cluster. That's 3% of total BC schools. And again, that by cluster, it means 2 to 13 children in that school with active COVID. And again, the median number per school is 3. So what that's telling us is on average in schools, when someone's gotten COVID, it spreads to another 1 to 2 children. That doesn't mean there hasn't been situations where it's spread to more, but on average, that's about how many more kids are being infected. So again, it's not that it means we shouldn't take it seriously, but it's not a huge driver of infection in children. And I think that's been a point of confusion and contention amongst parents, because obviously you want your child to be safe at school and you want the school environment to be optimized in terms of safety. But right now it does seem that being in school is a pretty reasonable choice for kids. Next slide, please. One of the other things that people sometimes wonder about is, what happens when there's a school exposure? So right now, what we are seeing is when in BC, if a student or a staff member is test positive for COVID, public health tracing, contact tracing occurs, and the investigations are triggered to determine, when was that person potentially infectious, who were they around, and how concerned do they need to be. If they attended school while deemed in the infectious period, public health staff will identify that risk of possible transmission, and there will be a notification posted on the website. Expanded public health postings of exposures for kids in K to 12 was initiated at the end of September, when case counts really started going up again in October, so they sort of stepped that up. What we know is there has been 510 schools where there's been a COVID exposure. Now, again, like I mentioned before, so that's 27% of schools, someone's had COVID in the school, but only 10% of schools have actually had a cluster where there's been spread within the school. So that's, I think, also somewhat reassuring. Like, even though children have been bringing COVID into the schools, it hasn't been causing a ton of outbreaks. And when it has impacted other children, it's been small numbers. So, we're kind of in an imperfect situation right now. We're living with this virus. It is around. It's hard to have the numbers be zero, but we're not seeing huge amounts of transmission happening in schools. Next slide, please. So, why is that? And how do we keep our schools safe? And what's important in terms of keeping schools safe? Because again, I think part of the reason we have the numbers that we do have is because of all the layers of protection that are in place right now in our communities and also in schools. So what do we need to be doing? Screening for symptoms and staying home if you're symptomatic is really, really important. That's probably one of the most important things. And I think that's where we've seen a real change in behavior with COVID, right? Like, I think in the past, your child had a bit of a cough or, had a fever the night before, vomited once, you'd send your kid to school. And now I think people are much more aware and being much more proactive, staying home if their child's sick at all. And that makes a huge difference. And that's one of the most important things you can do. Being tested and then having that reporting is really important. Trying to maintain physical distancing where possible and good hand hygiene and masking is important. And we're seeing the masking in place in schools in BC, and that's one layer of protection. And I'll talk a little bit more about where that sort of fits in terms of how protective that is versus other measures later. Cohorts is one of the things that was used earlier in the pandemic that hasn't been used as much this year. Ventilation is really, really critical. And I'm sure a lot of you have heard that sort of shift in the discussion around COVID that's been happening at the national level over the past week or so, where there's been more recognition that COVID is actually transmitted by an aerosol, or another term for that's airborne. There's been some reluctance to use the word airborne, but bottom line is it does spread in the air. And that's why ventilation in schools is really important. I think one of the frustrations I've heard from families in BC is, even though we know the Department of Education has made significant investments in ventilation in schools, it hasn't been totally transparent what schools and what exactly has been done. And I think that's been, again, a source of frustration for parents, as they want to really understand, what is the status of ventilation in my school. I think, another positive of ventilation being improved is that it means there's also going to be less other viruses, because the better the air quality, the less infection spread even beyond COVID. So that's positive. Of course, vaccination in schools when possible is another huge factor. So the adults that are in the schools being vaccinated, kids 12 and up, and now, of course, the option of children 5 to 11 being vaccinated, that will also keep numbers down in schools as well. And then good environmental cleaning. So it's really all about layering protection. There is not one intervention that on its own is perfect. And I think that's what's caused some confusion when we're talking about COVID, is naturally people sort of want that one answer, it's this or it's that, but there's a lot of gray here, as you can appreciate, and it is a shifting target as the numbers change in our communities and as we figure out more about the virus. So, another concern parents have had is, why universal masking, and why is it necessary to have kids masking? Up until recently, there's been a significant portion of the student population not eligible for vaccination. And with the NACI guidelines to wait 8 weeks between the vaccines, we're not going to have those 5 to 11 kids fully vaccinated for some time. So masks add that layer of protection. It will protect also unvaccinated students. Families that have maybe chosen not to vaccinate their kids will have extra protection. It does reduce transmission. We also know that right now because of privacy, we don't really monitor in schools who's vaccinated. So having universal masking makes the communication easier by having clear expectations and makes that simpler for people. We also know that the vaccine rates in different communities can be different, and knowing that the community rate of COVID really drives the case rate in kids, having universal masking protects all our communities, knowing that those numbers can really shift very, very quickly, especially with Delta. And of course, it provides protection against other respiratory illnesses as well, which is really important right now as we're seeing those things increase as we get into the winter. Right now, a lot of the hospitals are seeing a lot of a virus called parainfluenza, which causes croup, and also respiratory syncytial virus or RSV, which can be quite serious in younger kids, and in older kids causes more like a common cold type illness, runny nose and cough. Next slide, please. So I think the message here is really that this is the Swiss cheese model, right? There's not one thing that keeps us totally safe from COVID. It's really that layers of protection. And I think as we get in more and more into this pandemic, that's what we're learning more and more. I think originally, when we had original strain COVID, there was a lot of hope that the vaccine and high rates of vaccination would sort of bring the pandemic to an end. We're seeing with Delta, that's less true. And partly because there's still just enough people unvaccinated to really let the virus spread. And the vaccine isn't perfect. It's excellent for preventing severe illness and death from COVID and hospitalization. But because Delta is so much more contagious, some people who are fully vaccinated can still get COVID, although at a lower rate, can still spread COVID, although at a markedly lower rate than people who are unvaccinated. But the bottom line is all those things together mean vaccines alone are probably not going to get us out of this pandemic. And that's why we need these layers of protection, combining vaccine with public health strategies to keep the spread under control. Next slide, please. From a public health perspective, and when they're looking at schools, this is the layers of infection prevention and exposure control that they use when looking at communicable diseases, from least protective to most protective. So what you can see is at the very top are the public health measures. So that includes vaccinations, provincial health orders, testing and contact tracing, things like vaccine mandates for adults. Those are things, those types of strategies that give us the best protection. What you'll see is at the bottom is those personal things we do, like wearing masks. So it doesn't mean we shouldn't wear masks. Again, collectively, it really helps lower the risk, but in and of itself, it's not a really significant intervention just alone. So again, it's part of layering that protection. And of course, in kids, it's even trickier because for kids to wear masks properly all day is challenging. Some kids probably do it really well. Other kids don't do it as well. Kids also have to eat and drink. So it's hard to have your mask on all the time. But what's clear is the more people are masking, the more they're doing it continuously, the more we're optimizing it. It is creating safer indoor spaces, which is important. Next slide. So what's being recommended right now? They, of course, like the rest of the country, they're recommending everyone who's eligible is strongly encouraged to be fully vaccinated. As of mid-October, those were your numbers in adolescents. And when I checked the data today, we're up to 90% of 12 to 17 in BC who have had their first dose, and low 80% in terms of second doses. So those numbers continue to increase, which is important. I think that, certainly we've seen a big increase in vaccination rates since the vaccine mandates have come into play. I think some people are concerned, will there be a mandate for kids 5 to 11? And at this point, that is not something that's being discussed. It's not being discussed at any of the national organizations, and it's not being discussed really by any provinces either. So I don't know what's going to happen over the longer term, but right now the plan is not to have a vaccine mandate for kids under 12. Next slide. In terms of the recent approval from Health Canada and then the NACI guidelines that have followed, and today the Canadian Pediatric Society came out also with a statement on this. They're recommending that this is an important step to reduce the risk of COVID infection, hospitalization, disability, and death. And as you can see, it's now vaccine preventable, and the risk of COVID is very much in line with other infections we prevent with vaccine. And at the Canadian Medical Association, we are very much in alignment with the recommendations that have come forward from NACI. So we agree that it makes sense for that second dose to be 8 weeks after the first. And the other thing that came out from NACI is ideally in this age group, the 5 to 11, if possible, delaying other vaccines for 14 days. That's not because there's any concern about the effectiveness of the vaccine. So there may be circumstances if your child's immunocompromised or has some significant underlying health conditions that you wouldn't want to delay, but they think it's going to make it a bit easier to understand some of the side effects. And of course, addressing misinformation and vaccine hesitancy remains important. And I think it's really important that parents know it's absolutely normal to ask questions and have concerns. And it's important to go to trusted sources of information and your healthcare professional to help you with that. Okay. So I think I had a few other slides just more globally about child health, but I think I'm just going to stop here in the interest of time. and open it up to some questions. I think I've probably answered some of the things that people were wondering about just through the presentation, but I want to make sure we get to other questions that I maybe didn't touch on.
Absolutely. Thank you so much, Dr. Smart. I know you've answered so many questions actually with that wonderful presentation. I want to thank the hundreds of BC parents who submitted their questions to us in advance of this event. And, we let Dr. Smart know the kinds of things that you were wondering about. And as we ask these questions on behalf of BC families, I just want to highlight that we're here in our capacity as BC parents as well. We don't represent school districts. We're just parents seeking clarity for ourselves and other parents across BC. So when we looked at the questions, they sort of fell into a few different categories: COVID risks, masks, safety measures, symptoms, testings, and vaccines. So it's really similar to your presentation. And as much as we'd like to ask every one of the questions, we know that's not going to happen. And our team is going to have to move a little bit on the fly here because really Dr. Smart did answer so many. So we're going to get started. I think Simon is going to jump in first. Simon from COPAC.
That's great. Thank you, Nicola. And thanks again, Dr. Smart. And I do have to say thank you to Nicola, Rena, and Gord, who have done a tremendous amount of work behind the scenes to put together this event today. So thank you to all of you. Dr. Smart, our first question is from a parent in the Vancouver area. The question is, when is the off-ramp for children having to wear masks in schools, especially in areas with high vaccination rates and correspondingly low community transmission?
Yeah, that's a great question. And I think, all of these types of things, when can we get rid of masks? When are we kind of going to be more endemic versus pandemic? When can we start pulling back from some of these public health strategies? I think there's going to be multiple things that play into that. The biggest factor being what the rate of community spread is in your community and how that's impacting the hospital and health resource utilizing. Because what we're seeing, also right now is even though the case counts are going up in some communities or kind of steady, in some places it's associated with increased hospitalization if those numbers are in people who are unvaccinated. But as we're seeing in places with high rates of vaccine, more of those numbers be in people who also have been vaccinated, then that's when we start to see that decoupling from hospitalization, which is, of course, one of the important things in terms of protecting our healthcare system. So I think we'll see masks probably as one of the last things to go, just because in general, it's fairly easy to do for most people. And there is a fair bit of efficacy for it in terms of layers of protection. I think it will also depend on where we get to with vaccines in kids themselves, as those numbers increase and we're seeing those numbers go down in that age, then I think we'll start to see things like masking be taken away, at least in terms of it being mandatory. I suspect there'll be some people that just feel more comfortable masking and will continue to mask, other people who won't. And I think what we need to accept is that this is probably going to be a bit of a moving target. And I think we've already seen that in BC this summer, right? There was a period of things opening up. The mask mandate was removed. And then in different parts of the province, as the numbers increased, we had to come back to masking. And I think that's something we all have to get used to, is realizing this is an evolving situation and it is going to ebb and flow. And there's going to be peaks and valleys and outbreaks and lower numbers throughout the country as we go through this, and public health strategies are going to have to come in and out. So I think that can be frustrating and sometimes confusing for people, but it is because this is an infectious disease that changes and the spread changes and the impact on the systems changes. So we need to be fluid with that.
Thank you. Gord, you're up next from Vancouver DPAC.
Thank you, Dr. Thank you, Nicola. Thank you, Dr. Smart, for being here. I'm just relaying a question from Shannon in Kelowna, and it's a question about children and their ability to wear masks. It's wear masks well. And the question is, what are the best practices for mask wearing? Do they have to be frequently changed? And can children reasonably follow best practices for mask wearing?
Yeah, great question. And as I had shown on the other slide, I think that's one of the reasons, why mask wearing is absolutely a component, but not the top component, is because most of us don't wear masks perfectly. It's just hard to do. And obviously, the younger the child, the harder it is, right? What we know is the best mask is a well-fitted mask We're seeing now recommendations, now that there's been more willingness to recognize that COVID is aerosolized, that things like respirators would be more on that ideal end of the spectrum for a mask. But those, again, can be harder to wear. They can be more difficult to procure. Obviously, there's a cost to that. So it starts just becoming that balance between, what is the benefit versus the cost and the imposition of it. So I think for kids, really what we are wanting, what ideal mask wearing would be is ideally a well-fitted mask that's not sliding off their face, that it's comfortable so that they keep it on as much as they can. And then recognizing if it gets wet or soiled, then it needs to be replaced. So again, likely kids need to go to school with more than one mask. And absolutely, it's one of the things that's going to keep us safe. But I also think it's not something that we want to get totally obsessed with, because again, it's part of those layers of protection. So as long as your child's wearing their mask reasonably most of the time and everyone around them's doing the same, they're still going to get the benefit of masking, even though it's not perfect, because it is the real world that we live in. And I think we all just have to do our best in terms of that. So yeah, I guess that's what I would say about that. I think some parents, have decided to invest in things like K95 masks for those kids, or for their children, and those do fit better and do probably provide more protection. But again, the studies have shown they're most effective if they're worn continuously. And that's probably not realistic in the school setting where you have to have kids eating and drinking. So it's hard to know in real life, are we going to see a huge advantage of those masks versus just a well-fitted other mask? So there's lots of still, I'd say, sort of unknowns in this. But I think the best practice is a well-fitted, clean mask that your child will keep on more than they have off their face.
Thank you. Another question. I do have another question. And this is just basically on behalf of parents and PACs at schools across BC. You've told us that schools are relatively safe places, but layers of protection continue to be important. So what safety measures have you seen working in other provinces that parent advisory councils across BC should be advocating for as we continue to move on in this pandemic from kind of pandemic to endemic?
Yeah, I think what we're seeing in most provinces is similar to what's being done in BC. Of course, there's various things. Some provinces have much less in place. Some have slightly different things in place, but I think the bottom line is your schools are actually doing really pretty reasonably well. They are not drivers of large outbreaks in schools that have had clusters. It's really been a small number of children that are involved. So I think what that tells us is the things that are in place are working well. I think it would be nice for parents in BC to have more information around ventilation in their schools and what's actually been done there, and understanding that, because we know there's been investment made in that, but that part's not clear. So certainly having ventilation optimized is, I think, one of the really important things. And then I think the other piece is that ongoing case contact tracing and making sure that people are aware of exposures so that we can limit spread by people being able to monitor their children if they've had those exposures. So I think those are really the fundamental things. I don't think that you're missing anything substantial from your strategy. And I think when we sort of look at what's happening in terms of the numbers, it's overall reassuring. It's not perfect, but it's never going to be perfect. And I think that's part of what's hard for all of us as parents is sort of, how comfortable are we on that spectrum of risk? But overall, I think the schools in BC are continuing to provide overall quite a safe space for kids in terms of the risk of contracting COVID in that space.
Thank you. Thank you.
Okay, Rena from Surrey DPAC. You're muted, Rena.
Sorry about that. You would think I would have the hang of this by now. So this one was a question from West Kelowna, and it says, would you give this vaccine to your 5 to 12-year-old child? And that's a question directly to you.
Yeah, thank you. No, I think that's a really important and fair question. And I can tell you absolutely. I have a 13-year-old child who's already fully vaccinated for COVID, and my son is 11. And as soon as the vaccine's available here in the Yukon, which I'm anticipating in the next probably 10 days, I think we'll be a little slower than some of the other provinces, I'm planning to have him vaccinated. And again, when I was talking earlier about how do you make that decision? for me, it's really that analysis of the risk benefit. So I feel, from my perspective as a pediatrician and as a parent, that the vaccine is safe and effective. I feel very confident in that. And I feel that, in my view, the risk of a very rare adverse side effect is much lower than the risk of COVID for him. And I know that he will be exposed to the Delta variant at some point, and I would feel more comfortable with him being vaccinated versus not. So I'm really actually quite excited to get him vaccinated as soon as possible. And I think for me, it'll just take off that worry I have, not so much about severe disease, because that is very rare. Although, again, if it happens to you, it's 100%. So I don't want to minimize that that is a possible outcome. I'm more worried personally about some of those other things like long COVID and the multi-inflammatory systems condition, just because they are more likely than severe disease. But most importantly for me, I want him to be able to, do all the things he loves to do without having that worry around COVID. So I'm pretty excited about getting him vaccinated.
Thank you.
I would also add, he himself is quite excited. He keeps asking me, when can I get my vaccine?
I'm going to jump in with two questions, if that's okay. So just kind of pivoting off of your response, and really appreciate that. So for parents that are out there that have younger children, and I know you deal with young children in your practice. Certainly in our family, we talk to our daughter about her sort of her autonomy, over her body, and all of those sorts of things. Do you have any tips on how parents can have a discussion with their children, especially if they're younger and there's some fear involved, because of the needle and those sorts of things, without sort of, kind of keeping them a bit in the driver's seat, recognizing that as parents, we have a role to play in this here as well. But
yeah,
any just sort of quick talking points that might be helpful for parents?
Yeah, I think that's a great question. And I think it is really important when your children have to do something that's going to be unpleasant on some level. There's no child who's excited to get a needle, that you have a way of handling that as a parent. So I think it's really important to be honest with kids and set them up about what's going to happen, right? The worst thing you can do is lie and oh, no, nothing's going to happen. It's not going to hurt at all. You don't want to do that. You want to be truthful. You're going to get your vaccine. This is why it's important. This is what's happening with COVID. We're really excited that we can protect you from this illness, not scaring them, but just letting them know why it matters and why you think it's something they need to do. Then for a lot of kids, it can just be very helpful to be really just upfront about what's going to happen and give them some options along the way, right? So this is what it looks like, honey. We're going to go to the vaccine center on this day. When we get there, what do you want it to look like? Do you have a special toy you want to bring along? Would you like mom or dad to bring your iPad so you could watch a video? Who do you want to sit on? Do you want to sit facing the person giving you the vaccine? Would you rather face turn towards me? Do you want to see the needle or not? Right? Those types of things where kids start to feel some control and can make some choices that are actually theirs to make can be really helpful. So the choice isn't, are you getting the needle or not? The choice is all those things around getting the needle. And if you present it that way and you're very calm about it, your child will most of the time accept this as something that's sort of going to happen. But they feel, okay, there's some choices I have around it. And that can be reassuring for kids. If your kids are particularly worried about the pain of the needle, you can get numbing cream without a prescription from the drugstore that you could put on ahead of time so that they don't feel the poke if they're a kid that's quite sensitive to that. But I think often just providing that distraction, giving them some choice around how it's going to go down, and then offering them, a reward after, even if it's something just as simple as a sticker or a little certificate that they got their COVID vaccine to recognize their bravery, and giving them that positive feedback. All those things can make the experience much more positive for kids.
That's great. Thank you. Sorry, Nicola, should we keep moving forward or
Yeah, Dr. Smart, and we're just looking at the time here. It's 7:59, so we'll leave it to you. Do you have a few more minutes to answer?
Yeah. Oh, yeah. I'm good for time. So if you guys are okay to keep going, that's fine for me.
Perfect. Thank you so much.
I think you have answered this question, I think, but I think it's worth me mentioning it again because it came up in many comments, and we had many questions along the themes of the public has been told that children are not at high risk, they do not get severe symptoms, and they generally do not cause outbreaks. Schools are, generally a safe place. but it feels like there's a big pressure to get vaccinated, and it feels like the messaging around this has changed. And why is there this pressure? And has the messaging changed?
Yeah, I think that's like a very fair question, and I can totally appreciate why it feels confusing to people. And I think what this sort of deals with is the crux of trying to provide people with information in a context where they're trying to assess risk, right? So really all that communication you're talking about, how people have been communicated to about the risk of COVID in young children, the risk around school, how worried to be about it, is really about risk and what your personal perception of risk is. So it is absolutely true that the chances of a severe outcome in COVID in children is rare. But, as I showed you in the talk, it's not that different than what we see for other diseases that we prevent with vaccination. And also bad outcomes in children in general are very rare in most conditions. So, that metric is different in kids than adults. So that's partly why it's, when we're looking at it, slightly different. I think, we want people to know the facts, which is, yes, in general, overall, schools are relatively safe. That doesn't mean no one's ever gotten COVID at a school, but they are not driving the numbers in kids. That's really, really quite clear. Is it going to be better when kids are vaccinated and there's less risk of transmission at school? Yes, absolutely. These things, again, all layer together and make the risk less. So then, I think, well, why now the vaccine? Well, I think it's much like these other diseases we were talking about. What's changed is now now COVID is vaccine preventable. So the lens we would have as healthcare professionals is, why would you take any risk for your child if there is a safe alternative that can prevent it? And, another sort of thing I was thinking about that I wonder if helps people sort of think about risk is, I was thinking about something like car accidents. When you look at what is the leading cause of death for children in Canada, it oscillates between cancer and preventable injuries, largely motor vehicle collisions or bike accidents, not wearing a helmet, those types of things. And when you look at this age group, the way they report the statistics in Canada is slightly different. It's 5 to 14 years old, but there's 28 kids a year that die in preventable accidents, largely motor vehicle collisions, and about 285 that are seriously injured. So not dissimilar sort of to COVID, right? But every one of us, I'm sure, puts our children in a car seat or in a seatbelt when we get in the car. I've been doing that for 13 years. I've never been in a car accident with my kids, but I'm not about to take the chance, right? To me, the seatbelt's easy. I know it works. If I get in a car accident, my child's going to be protected, even though the chances are remote that's going to be me. Well, what if it is? And I think vaccination for COVID is sort of similar, right? The risk of your child being the one to have the horrible outcome is fortunately very low, but it's not zero. And we can take that risk away by giving them a safe and effective vaccine. And that's why it's being promoted. It's not that the risk has changed. It's just now it's something where we can prevent that risk. And I think that's what we're hoping to convey to people.
Thank you so much. Thank you.
Rena?
So this question was asked by a lot of parents, actually, and it's kind of creating a little bit of confusion here. So we have it says, my child is 11 years old and will be eligible for the adult vaccine in January of 2022 because of their birth year. Should I be getting them the child vaccine or the adult vaccine? Would it be worth waiting? Yeah.
Yeah, great question. And that was actually addressed directly by NACI in their guidance. So the recommendation is quite clear. They should get the vaccine now at the pediatric dose when they're 11. And when they get their booster or their second dose of the vaccine, they would get the adult dose at that time. So if your child's going to turn 12 before the 8 weeks are up, they'll get 10 micrograms for the first dose. They'll get 30 micrograms for the second dose. So there's no reason to delay, and you'll still get an excellent immune response from that 10 microgram or the pediatric dose of the Pfizer vaccine.
And what would you suggest then if you have a child that is, slightly smaller in size? Because not all 11-year-olds are the same size, right? So what if my 11-year-old is more petite, but she's going to be 12 in the next year?
Yeah, that's a really good question as well. So vaccines are never weight-based because of the way they interact with the immune system. It's not like other medications. Like, that's a really good question, because often in kids, right, the dose is based on the weight for medications, but the way vaccines work are different, and they're not weight-based. So it's just really based on the immune response, which is slightly different in younger kids. And that's why we've been able to use a lower dose of the vaccine in younger children, is their immune systems generate a more robust immune response. And then, of course, by having the lower dose, we decrease the risk of side effects. So there's that sort of benefit.
All right, thank you so much.
Our next question is from a parent in Lake Country. How many children in this age group were involved in the clinical trial? And do you feel that is a large enough group to confidently recommend that children get the vaccine without potentially putting them at risk?
Yeah, also a really fair and excellent question. So the study had about 3,000 children. And again, as I mentioned, it was an immunobridging study. So it really looked at, do children mount an adequate immune response to that dose of the vaccine? That's what they were asking. And the answer was yes. In the trial, there was no serious adverse events, which was great, but obviously it is a small number. And that's why that post-vaccine surveillance is so important, to make sure that there isn't anything rare and unanticipated that might come forward. We're not expecting that to be the case, but of course we don't know till we have all that post-vaccine surveillance. As I mentioned, there's been 3 million doses already given in the US with no signals of anything unexpected. So I do feel confident that the vaccine will be safe. Will there be the odd rare adverse event? That's certainly possible. But again, like we've been talking about, it's really about balancing out risk. I think the risk to the individual is probably more that you would have one of those complications from COVID itself than having a rare vaccine event. But I think for parents who are really particularly anxious about that, the bottom line is we're going to just keep knowing more and more about this vaccine every day. And that I think will hopefully be reassuring to people that really have that concern.
Great, thank you.
Mark?
I just want to dovetail on to Simon's question. You have mentioned, there's a vaccine follow-up through IMPACT. If we're concerned about side effects for our young ones, let's say at 8-year-old, what symptoms should we be watching for if we decide to vaccinate them? What should we be watching for afterwards?
Yeah, great question. It's really just the same side effects we see with any vaccine. So that soreness at the site of vaccine, sore arm, sometimes local redness or swelling where they received the vaccine, and then sometimes fever and fatigue. Those are the only side effects that have been identified right now. And if your child did have, significant headache or significant sore arm, you can always treat that with Tylenol.
Is that so I guess parents are worried about, for example, myocarditis being that
Yeah.
The most severe one, and so in that case, what would they be looking for?
Yeah, so then what you'd be looking for is the main symptoms for that would be chest pain or shortness of breath. So if there was a lot of, I'm feeling like I can't quite catch my breath, or I'm feeling a lot of chest pain, then that would be a good thing to see your healthcare professional about.
Rena?
Yes, so I wanted to go back to the layers of protection that you were referring to. As our group, we did, petition to the ministry to help us get HEPA filters into the schools. And we were provided assurance that they have MERV 8 and MERV 11 within our district. And they said that it should be adequately enough. But the parents, with all the information that we're getting, they're saying that MERV 13 HEPA filters is the filter that does provide a bit more protection. And I was hoping that you could touch on that. And the other follow-up, I guess, that we could do is, what about when we're at home and we're having our relatives come over, like, for example, the holidays are around the corner. Should I, as a parent, then be considering about purchasing a HEPA filter, having that running, because we know that we're not going to be having masks while we're all gathered? Is that another layer that we should be thinking about having in our own homes?
Yeah, that's a great question. I think again, this is what's complicated with the ventilation question is, how much ventilation is enough ventilation, and what is sort of the spectrum of that in terms of what's perfect. It's kind of like anything, there's good, there's great. It sounds like your schools have a pretty reasonable level of ventilation happening already in them, which is reassuring. Certainly better than what some older schools have. So I think that sounds quite reassuring. It's a good question for in your own home. I think that is going to be interesting as we move into the holiday season. And I think, again, there'd be several factors. How many people are coming over? Is everybody vaccinated or not? What is the community rate of COVID at that time? Because all those things are, again, layers and factors in terms of what that risk is going to be. And what's, is there anybody in your family who's maybe immunocompromised? who maybe has other underlying conditions that might make them less likely to have had a good response to the vaccine or put them more at risk if they were exposed. Certainly improving the ventilation in your home would be one thing that would be helpful. But I think, how necessary is that would sort of depend on all those other factors. And I think that's what's challenging, right, with all of these decisions. There's always more and more you can do. And it starts becoming, where's the balance for you personally? And I think that, again, is a personal decision where you have to decide what's your risk tolerance and what's the risk to the people in the room, right? If everyone there is fully vaccinated and no one has underlying conditions and the rate of community spread is reasonable, probably the risk is overall quite low. But that could be very different if suddenly we're seeing, increases in case counts. And in that case, you may want to add that layer of protection. So it's certainly nothing that's going to cause any harm. I think it just comes down to, is that a cost that's accessible for your family? And if it is, and it's going to make you feel better, then great. And again, I think that's what's challenging with a lot of some of these different sort of layers of protection, is how accessible they are for different families can be variable as well. And I think that also comes when we're talking about mask quality, et cetera. Not everyone can afford to buy their child a disposable K95 mask for every day that they go to school. So we have to sort of, I think, have a range of things that are available to people that are based on their own personal risk tolerance and what's accessible to them.
I think we'll try and get 2 more questions in, if that's okay.
Sure.
And then we'll wrap it up. Simon?
That's great. Thank you for your time, Dr. Smart. We had sort of a number of the questions that came in from parents across BC touched on the question of situations where their children have a condition of some kind. So, we heard from parents who had children who had allergies, who had been through cancer treatment, arthritis, et cetera. And so the question from parents is, what are sort of what might be some of those cases where the COVID vaccine would not be appropriate for a child that has an additional condition?
Yeah, that's a really important question. And I think for anyone who has a child who has a really serious underlying condition, it's really important to have that conversation with your healthcare professional. Those types of individual medical decisions really need to be made with someone who knows your full history and can go through a risk-benefit analysis for your child specifically. Certainly for the vast majority of children that have underlying conditions, they're going to benefit from vaccine, because often those conditions make them more likely to fall into that category of having severe disease. But if you have a child and for a particular reason you're worried there may be a reason for them not to be vaccinated because of something that's happened to them in the past or something specific about their health, definitely have that conversation with your healthcare professional so they can reassure you or perhaps inform you that maybe that's not the right choice for your child. So I absolutely would not hesitate to reach out about that. It's going to be really uncommon for there to be medical reasons not to be vaccinated, but there may be some, and those I think are need to be made at that individual level.
Great, thank you.
Okay, Gord, last question.
Thank you. So this is a question for families that may, where the child may have parents that reside separately and may have different opinions. I mean, this is really much of the pandemic has been very emotional, and so the question is, for children who are in split families with parents that disagree about vaccination, do you have any advice or suggestions to help with their decision-making process?
Yeah, that's such an important question. And I so agree. I think one of the real tragedies of this pandemic is how divisive it's been for people, both within families and with friends. And it's been very polarizing for some people. And I know that's been really hard and it's really contributed to the emotional toll. I think in scenarios, where parents are not together, it is challenging. I mean, obviously the ideal scenario would be that you can come to an agreement together around your child's being vaccinated. If you have older children who are over 12, often they're able to consent on their own. So you don't necessarily need both parents to provide consent, and it can become more of the child's own medical decision. And so far in kids of that age group, that's what we've seen when it's gone to court, is that the court has sort of upheld the child's right to be vaccinated. It gets more tricky as kids get younger because, of course, it's harder to argue that, a 6 or 7-year-old can really make that decision. I think what we're practically going to see happen is if people are not able to come to a decision them together, and one parent feels strongly for and the other against, that's likely going to end up in court. But likely what will happen is the court will side on the side of the recommendations of medical professionals. That's usually what happens in this case. And so if your physician has recommended your child would be vaccinated, which will be in general the recommendation of physicians, then it's likely that the court would side on the behalf of the parent choosing to have their child vaccinated. But again, different situations may be different. I think we never want conflict between parents. It's always much better for children if parents can work as a team, at least around parenting. So it's not that I'm encouraging anybody to go to court, but just practically speaking, if there's not been a decision, that's where those types of decisions ultimately have to be made, because it's not something that medical professional can decide for you. It's something that needs to be decided legally.
Yeah, it is a really tough topic. Thank you so much.
Yeah.
Thank you, Dr. Smart, so much. On behalf of parents across BC, I'd like to express my gratitude to Dr. Smart for all of your time, your presentation, and your thoughtful answers to the questions from BC families. I'm not sure if the timing for this event could have been better with the recent announcement of Health Canada's approval of the Pfizer vaccine for children aged 5 to 11. So thank you so much for everything. I know we were not able to answer every question that was submitted by any means, and some of the questions we received might be best answered by other members of the medical community, members of our provincial government. We encourage all families to consider or to continue to seek answers to their questions around COVID safety measures and vaccines by contacting their regional medical health officer, the BC PHO, BC CDC, their MLA, or their own family physician. Keeping your local DPAC informed of your concerns is a great idea too. I hope this evening has helped BC parents gain some knowledge and clarity to some of their questions about COVID-19 and their kids. So thank you all for attending. And before we go, I just want to take a moment to acknowledge our teams at the Central Okanagan, the Vancouver, and the Surrey DPACs for their support on this event, and to the BC mom and PAC friend who asked Dr. Smart if she would be willing to present an event like this. Thank you all so much. Thank you, Dr. Smart, and have a wonderful evening. Good night, everyone.
Thanks so much for having me.
Thank you.